Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're doing another care plan, so let's get into it. CK is an 87-year-old patient who has fallen at home and broken his hip. You are caring for him post-operatively. So for this patient situation, I didn't want to do like the obvious nursing diagnosis of acute pain. You definitely can, it definitely makes sense, but I wanted to do something a little bit different that still would be appropriate post-operatively for a patient of this age. So that's why I chose the two nursing diagnoses I did. So the first one is risk for infection and related to the surgical incision. And you can use this diagnosis at any surgery, okay? So it doesn't matter what kind of surgery they've had, it doesn't matter how old they are. Post-operatively, this is a great diagnosis for you to use. Our goal, the patient will remain free from infection by discharge. And how are we going to make that happen? We're going to assess the wound appearance and wound drainage. Our rationale for choosing that: redness, swelling, and drainage are indicative of infection. So if we assess the wound and we see those things, we know, okay, I think this is infected. And then our evaluation, we can say that our goal was met. The patient's incision showed no signs of infection by discharge. The second diagnosis I picked was more related to their age and kind of everything that's going on. So I put risk for acute confusion related to their age, the stress of the trauma, so of getting hurt and having the surgery, and the medications that they're going to be on post-operatively. So all of these things can contribute to the patient being in a confused state. So our goal, the patient will remain A&O times 4 by the end of the shift. So while we're taking care of them, during our shift, making sure that there's still A&O times 4. And how are we going to do this? We're going to assess their mental responses to the medications. So a couple of things. We said age, we said the stress of trauma, those can definitely contribute to acute confusion in this patient, but I specifically chose medications because that's probably going to be the biggest one, okay? That's going to be the biggest contributor. Assess mental responses to medications. And our rationale, older adults tend to be more sensitive to medications. So that's what we're looking out for, okay? We're looking out for any side effects or any adverse effects to the medications that the patient is on. And then our evaluation, we can say the goal was met, the patient remained A&O times 4 by the end of the shift. So that was a quick one, a simple one, but I didn't want to be like so basic and say acute pain, you know. I wanted to do things that were actually common, but we don't necessarily always talk about when we do a care plan for somebody who's just had surgery. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.